Actually, the first question is there a way to determine when genetic testing should be considered?
That's a great question. What we are doing, as we said in the presentation, was that we try to do it at the onset of seizures. So as soon as a child is diagnosed, when they come in for the first visit, we try to do the genetic testing. Otherwise, typically it's done if the seizures become refractory, and everybody sort of has their own way of doing it, but we really think it's important on almost everyone.
Okay, thank you. And the next question is, my 28-year-old son has done 2 of these tests, and last minute a spark went to the other side. So now no operation. Now what?
Well, I'm not able to comment precisely on what your son, what he underwent, if it was a stereo EEG or a grid. What you try to do in any kind of resective surgery is you target the area where the seizure starts and not necessarily where it ends. So if he's not eligible for resection, he might be a candidate for one of the neuromodulation devices.
Great. Thank you for the information. You spoke about mutations in genes. Could duplication of the genes also lead to epilepsy?
Yes, absolutely. The mutations was sort of a catch-all phrase for all the different things that can happen in genetics.
When you say refractory, what does that mean?
Refractory means that you continue to have seizures despite having tried 2 or more medications that are the appropriate medications for the type of seizures you have, and you didn't have it not related to side effects, more that they didn't work. So choose 2 medications, right dose, right medication, and did not work.
Okay. Epilepsy as a result of a brain lesion, a cavernoma. How does this determine the type of medication for seizure?
So a cavernoma would cause a focal or localization related epilepsy. So you wouldn't have to worry about it being a genetic epilepsy. You would just use a medication that works on focal seizures, or a more broad spectrum medication that would cover both focal and generalized seizures. Or you can do surgery to remove the cavernoma.
How do kids start the keto diet?
It depends on who your dietitian is. You do a lot of testing, a lot of blood levels to start with. It depends on the age of the kid. It's usually started gradually and then increased. Oftentimes it's done in the hospital so that the patients can be taught. Or if the child is either, as we said, tube fed or still on formula, you just use the formula. Can be started in the hospital, it can be started at home.
What are some basic safety recommendations for the home that you recommend families with kiddos with active seizures?
That's a really good question, and something that we did cover, and I'm going to make sure that we add that to our talks in the future. So the biggest issues are making sure that they can't fall and get hurt. You don't want to stop them from doing everything, but stairs should be carpeted. Someone should keep an eye until their seizures are well controlled. No one should take a bath, only showers if they're having ongoing seizures. You can drown in an inch of water. The door to the bathroom should be unlocked when they're in the bathroom for older teenagers. You can, you also have to be careful about stove guards along the stove. Dropping things, keeping the medications stored away safely. Lots of people will keep the medications in a kitchen cabinet so they can put them out in the morning. So make sure that it's locked and the kids can't reach it. Throw rugs, the usual sort of things that you would do normally, but just to make sure that they're not at risk of being hurt, and making sure that you have the rescue medicine, that you know where the rescue medicine is, and you know that you can get it quickly if something happens.
My 17-year-old has the RNS and his seizures are not controlled. It's been in for 1 year and 7 months. He seizes when sleeping or going to sleep or coming out of sleep. We are using a doctor at CHOP. What now?
Go back to them and ask if they need to adjust the RNS. There are many different ways to adjust the RNS. It does take some time to get it precisely under control. So, and you can use medications with it. You can even use the RNS as a bridge to a resective surgery. You can also use an RNS in conjunction with the VNS. You know, there are many different ways, but I would go back to the team and discuss that.
There's lots and lots of questions coming in. I'm trying to keep track. I keep reading about naturopathy options like Chinese medicine, herbal medicine. Do you send your patients for anything like that?
We do not personally, we have not seen it work, but that's a matter for the individual to decide, the family to decide. Oh, you should also be careful about supplements. Some of the supplements can make seizures worse. So always make sure that when you come into your healthcare provider, if we forget to ask you, make sure that you tell us what else the person is taking.
My son has temporal sclerosis and was diagnosed with temporal lobe epilepsy. How often do medications work in these cases?
The best treatment option for temporal sclerosis is surgery, as long as it's not in the dominant lobe, but there's lots of testing that can be done to make sure that memory and language are intact. And if you go to a good epilepsy center and proceed for the surgery, they will make sure that there's no harm done. But that is the treatment for temporal sclerosis.
Okay. Let's see, I have a thank you for a great presentation.
Thank you.
Should we ask for doctors to test for vitamin levels?
No.
Not necessary, okay. All right, so it looks like those are all of the questions right now. I'm just gonna look one more time, make sure I didn't miss anything. Yeah, that's oh, one new message. Okay.
Yep.
Okay. My 28-year-old lives alone and has been having breakthrough seizures. Just started Excopri, his third medication, and due to encephalitis, which brought seizures on. Should he have a roommate because of going to hospital so much, also low sodium?
That's a really good question. You know, and as a mother, I sure would love to have him have a roommate. I don't know whether that's something that you can put on a roommate, though, to have that responsibility. You can get the SAMI camera or the Empatica or the Embrace watch, and you can have that looped to your cell phone if you live nearby, so that you'll know if something's going on.
So far, that would be it. Okay, I don't see any other questions coming in.
All right, great. I thank you all for being here. Those are great questions, and I hope it was of use to you. And I thank all the epilepsy groups for sponsoring this today. This is a great initiative, and I hope to see more of them in the future.
Thank you.